Dr. Girish, and this is the third time I am making an interview with you. Yes,
Yes, sir.
for past 1.5 years, and and for the same specialty of MCH plastic surgery.
Yes, sir. Thank you, sir.
And I bring in all the wishes and greetings from Speed Institute to you for a continuous effort from rank number 1 in JIPMER in plastic surgery. Then after that, in ESS, the score was around
17.
17. And now rank number 4 in NEET SS 2022. Yes, of 2021 session, the exam was from 2022. Now, I want to know from Dr. Girish what he wants to do. I mean, he is getting plastic surgery everywhere, and what is he doing right now?
Currently, I'm completing my bond. So I have joined my UG institute, Rajiv Gandhi Medical College, to finish my bond, and I'm doing my SRC. And and I'm now thinking of which college to take. But mostly it is going to be through NEET. So either Mumbai or Delhi.
So you're going to take an admission for MCH plastic surgery through NEET.
Yes, sir.
Is that a final call or something else is also there after that?
No. This time it is final. This time it is for keeps.
Okay. So, I mean, can I know the reason? Why is that the specialty you are getting in every exam, and why is that not settled in past 2 exams and now why in NEET?
The primary reason for JIPMER, as I had previously explained, I was not able to adjust there. And after spending about 2 months, I had made a decision that I could not continue there any further. So after that, again, so I took some time for myself. I thought as to what exactly are my priorities right now, and I came to a conclusion that it is definitely plastic surgery that I want to pursue further. And so for that, I would again give all the exams. So I gave NESS, and in NESS I have got rank 17. So at that rank, I was not able to get the seat of my choice, which was either Delhi or Rishikesh. So with that in my mind, I had 1 month to prepare. So in that, I thought to myself that this is the last attempt this is the last entrance exam for MCH that I would be giving. So I have to give my best, and that is why I gave my NEET exam on 10th of January, for which the results came in yesterday.
Now, how you are able to keep yourself on? Because people always think, okay, well, let us get rid of things with this exam and thing will settle. Because I'll tell you, even the exam results came yesterday, and people have got a score which they don't want to have, and they are forcing themselves to take something. And I'm also making a video on that. And because this mindset is very important, that you need to do what you want to do. And that's what, you're being a standing example that I'm seeing you for more than 1.5 years with repeated attempts and the repeated topmost ranks, but still you have not got into any of the institutions so far. And you said, NEET, I'm going to go in, and after your admission is over, then I'm going to believe that. And and definitely you will take it, I'm sure. And how is that mindset? How are you able to get that mindset?
I would be lying if I said that I didn't have such thoughts. Why shouldn't I start my career with general surgery and settle? But again, the same thing is that the thing is you would want to suffer for 1 or 2 years and not suffer for the rest of your life, rather than doing the opposite. That is the thing that motivated me a lot, and that is the one thing that has kept me going. And also along with that, also there was my family who supported me with each and every decision. My teachers, whom I'm very close to, did support me with my decision, no matter what I took. So with that support in hindsight, I think I had a safety net behind me. So that propelled me to take this leap of faith, as I could say.
Great. And what is the message that you want to give to your juniors and friends?
Don't take a specialty only because it is easy to get. make sure you know yourself first, what you can bear, or what is your calling. I won't say calling, but do something that you like to do, something you don't get tired of. So once that is there done, then it becomes easy. Then you know what you want, and when you know what you want, then that is the only thing that keeps you moving forward.
Great. Now, I just want to ask you, in what way, because you have given the institute exams, you have given a JIPMER exam, and you have given NEET exam, in what is the difference between all this? I mean, what is that you feel that might some adjustments need to be done for the aspirants for plastic surgery?
Now again, with the changing pattern, the method of preparation keeps on changing. What I can say for the past 2 or 3 years is that NEET is going to be more predictable than NEET SS. With a changing pattern, with changing number of questions of specialty being asked in general surgery, it becomes very important to be well versed in the specialties as well. Even though you're not giving its paper, like this time around 10 questions were from Ashcroft, pediatric surgery, even though I was giving plastic surgery and GI surgery. So that is a thing which is different. But with INICET, it is very predictable, and I think that is an exam if prepared well for.
Yes, doctor, go ahead.
So I would say INICET is more easier to crack. With NEET SS, with changing patterns, now we'll come to know once the prospectus comes in. But apart from that, it becomes very, very essential that one is very well versed in Sabiston, Bailey, which is the Bible, and some parts of Schwartz as well. So once that those three are clear, 60% I think of your general surgery and your specialties is done for. And apart from that, I think the specialty, in speed, the thing that helped me was the recent updates from Sabiston, the combined approach that you give integrated surgery and daily based MCQ. So once you're done with all of this, I think it becomes all the three textbooks become combined. So for those who don't have enough time to read textbooks, that this approach helps. This format of preparation has to be carried on later.
Okay, great. Now, how many questions did you attend this exam? Remember? Don't remember?
Yeah, I do remember. But the answer is funny. Again, it is the 90% of the 100 questions that's all.
How much? 90, yeah?
Timing for me, I wouldn't want to boast, but I don't feel timing is at all a factor while giving NEET exam or any of the exams. If you know a question, you know a question. If you don't know a question, you don't know a question. The key is getting through the questions that you know within the shortest span of time for the answer for which you know. So that gets over in 30 minutes. And rest you think for which you have to think about two options. You have all the time in the world. So timing is not a factor. People complain that timing is a problem. They're not able to finish a question. But if the preparation is right, you know what questions are going to come in. You know what the options are going to come in. So it does not. So timing is never a factor.
No, I'm asking about number of questions you attended.
I attempted 90 questions.
99.
And those, and if I did not have any idea about the question or the answer, I would leave it, which happened more in general surgery than in plastic surgery.
Okay. So great interacting with you. I'm really delighted to talk to you and interview for the third time. And after your seat in MCH and NEET in plastic, again I'll make an interview with you.
Sure.
Thank you. All the best to you.
Definitely, sir. Thank you so much.
Thank you.